Leone emerged from a civil war recently which severely damaged its communities and especially the infrastructure across the country. 10 years on, they're still trying to rebuild the health services, and that's especially the case with mental health, where there is really a significant lack. Just to give you an example of what this looks like, there's been estimates recently that there's about 13% of the population that suffers from a mental health problem, and yet there's only one trained psychiatrist in the country for a population over 4 million people.
Extensive research has identified a significant treatment gap across the world. Treatment gap basically means that there are large numbers of people who don't access or can't access any help or support for their mental health problem. This gap is biggest in low and middle income countries, and on average less than 1% of health expenditure in low and middle income countries goes on mental health services.
The issue of mental health is unique to Sierra Leone. It's new. Before this time, before the emergence of the coalition or programs on mental health, you realize that even when you look at the budget for the Ministry of Health, they're very meager. Maybe not even considered. There is a need for networking. Because what it does for us, it helps us know methodologies service users should employ in administering, because you realize that before this time there are traditional methods without beating, exorcism, chaining, those brutal methods that are against human rights.
Because the infrastructure really isn't there with mental health services, so much of the support for people with mental health problems across the country is within their communities. It's family members, sometimes traditional healers, other individuals that are important within the communities.
A national survey that CAPS did showed that the majority of services are in the community, but they're offered by traditional healers and religious leaders. And then there's the psych hospital. That's the only government facility. If we think of mental health care traditionally, it is being offered in the community, but it's not evidence-based.
The mental health nurses have mainly been trained in Western models, in the medical model, and that's particularly problematic in a country that there's very little access to psychiatric medications. And so there certainly is a need for more psychosocial approaches.
This study has evolved and has come out of some work which we're doing in England and in the UK. And we're very concerned about the social environment in which people are living. So it's the context of an individual with mental health problems and the support, their access to social resources in their immediate environment. Some of the ideas which we are working from here are related to the notion of social capital. Now, it's quite a disputed concept. It's an idea which means different things to different people, and we're understanding it, as many other authors understand it by, as social resources which people have access to from within their networks. We undertook some pilot work a while back in India and Malawi to test out whether the notion and the ideas around social capital could apply in those countries and in those very, very different contexts. We found that there was strong resonance, that people understood and the concepts, the ideas related to their context. That indicated to us that some of the ideas, some of the theoretical ideas, are translatable or can be used in very, very different cultural contexts.
The first part of the study has been a feasibility study, and that was a visit to Sierra Leone, myself and a colleague from King's Centre for Global Health, which is based at King's College London. We were able to meet with stakeholders at all levels of the mental health sector in Sierra Leone. The feedback that we received from stakeholders in Sierra Leone was very positive, and they were saying that these ideas about social capital and the ideas about relationship building and connections in the community are quite relevant to the social context that they're coming from. And some of the specific elements that we were able to discuss and that they really pointed out were things like building trusting relationships between a healthcare worker and an individual, and having that healthcare worker be connecting them with people in the community and somehow enhancing their role within the community. And that's really breaking down the stigma, which is so prevalent in Sierra Leone. And some of the traditional beliefs around mental illness that are present there can really be sort of broken down by that healthcare worker.
You realize that the relationship between the service provider and the service users is very important.
Yeah.
The relationship between the families and the service users is also very important.
Yeah.
These are major areas that we struggle with.
I'm also thinking of this relationship can also help with this self-stigma.
The feasibility study that we've just conducted provided such rich information for us and really gave us the context in Sierra Leone, what mental health services look like, what the workers' experience and training capacity has been thus far. The relationships that we built with individuals in Sierra Leone are relationships that we want to continue fostering once we've come back to the UK, and so we'll be continuing to collaborate with these individuals from a distance and adapting and developing a model of practice that fits in Sierra Leone, as well as developing a training program which highlights some of the gaps in the training that mental health nurses have already experienced, and sort of fill those gaps with psychosocial approaches and look at it from the social capital perspective.
We have that hierarchical structure, which has not been helpful. So if it is changing the mindset of seeing work as a partnership project, then it would also help in looking at what we do. And citing what Mr. Billy was saying, the service providers would not chain or keep the individuals themselves because they would see them as partners.